symptoms in their mid back or in the lower back, and they might wonder if the neck pain is contributing to their back pain, or vice versa. It may happen that you have back pain, that is mid or lower back pain, and then you start to get some neck pain, and you're wondering if the two of these are related. So in this video, let's discuss more on how your neck, mid back, and lower back pain can be related to each other, and do they actually cause, I mean, pain in one area, does it cause pain in the other areas? So for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids manage their spinal, that is back and neck, and joint pains. Now, I do this by giving you simple exercises, easy lifestyle change tips, simple tips, tricks, and hacks, and some natural remedies that have worked for me along in my spinal and joint pain journey. All right, so let's get back into the topic, which is, can neck pain or neck problems cause pain in the back? So now let's talk about two different ways in which this can happen. So of course, there are more than two ways, but these are the two common ways in which your neck pain can contribute to a pain in your back. So what in your spine, if you look at your spine, what happens is it's a complex arrangement of bones, soft tissues, muscle, connective tissue, ligaments. I mean, there's a lot of structures in and around the spine. So when you're looking at the spine, say you go to the doctor and they tell you you have neck pain, your spine doesn't work in isolation. So your neck will not work in isolation with your mid back to your lower back. So when the doctor gives you a diagnosis of neck pain, yes, they're referring to your cervical spine. However, this will, especially in the long run in chronic pain cases, this will start to affect your mid to lower back as well. So there are many muscles that cross over from your neck to your mid back to your lower back. There are many ligaments that are running along the spine. So the strain or the stress or the pain that you feel in your cervical spine will be transmitted. Say if there is a spasm in your muscle, or there's a tightness or stiffness in your neck because of a tightness in that muscle. Now, if that muscle is traveling down into your mid back or your lower back, the muscle tightness will happen throughout the muscle, right? So it's going to get transmitted to your mid back and your lower back. Probably if you have say if you were to rate the pain in your neck, maybe it's 9 out of 10. Okay, so maybe the pain in your mid back or your lower back may not be 9 out of 10, but at least you'll start to get that niggle of pain, that 1 out of 10 pain or 2 out of 10 pain in the rest of your spine as well. It is not necessary that it happens, but usually seen in long-standing or chronic cases, as I said earlier. Just referring to my notes here, another thing is your spine. When you look at it, there are these core muscles, that is the deepest muscles that are present along the spine, all the way from your hairline down into your tailbone. Now, when the balance of these, when the strength in one part of the spine, or the strength in the core muscles in one part of the spine is affected, it will automatically start to affect the strength of the core muscles in the rest of the spine. Because say my cervical spine core muscles are weaker, so the rest of the spine will have to, the rest of the muscles around that area, say the shoulder or the shoulder blade area or the upper back, will have to work more in order to carry on with the daily activities, because the cervical spine muscles are not working as much. This is especially true for your core muscles. Let's take an example. It's like if in an office, there are 3 people working, one is off sick or not performing 100%, the other 2 have to carry the load. That's exactly what happens with your spine as well. Now, the other thing that happens, this is probably not true with acute injuries in your neck. Again, going to the more chronic cases, when you have a poor posture at your neck, what happens is, suppose I have a forward head posture. Now, this is one of the commonest poor postures that is seen at the neck. So if my neck is, say, this is my earlobe, this is my shoulder. So my earlobe should be in line with my shoulder tip. This is a proper position of my cervical spine or my neck. Now, when I have a forward head posture, which is quite commonly seen nowadays, this Head is going forwards, my body is here. In order to balance my head on top of my body, my upper back will have to go in this position. Basically, these are rounded shoulders and a rounded or a curved upper back. So if your posture in one area of the spine is basically you're not in a good posture, if it is compromised because of say weak muscles or any other reason, because of injury or whatever reason you have poor posture, it will manifest into your mid back. And once your mid back is rounded, you will realize that it is very difficult for you to maintain a good posture at your lower back. So try doing this. If you're sitting upright and you round up your shoulders, you can do it with me now. You will realize that you're not able to sit upright. You will automatically slouch at your lower back as well. So this is another reason why your neck pain, because of that poor posture at the neck, will get transmitted to your mid back and then to your lower back. So in a nutshell, our spine does not work in isolation, our body does not work in isolation, but your neck pain will not be the sole cause of back pain, but it can influence your back pain as well. So well, the solution is to obviously address the cause of your neck pain, but also to make sure you're in a good posture, you have strong core muscles, and you work on the strengthening and rehabilitation of your full spine and not just the neck. Right? So, well, that's all I have for you today. And if you have any questions, any comments on this video, do drop them below and I will address them for you. If you're looking for some simple strategies or advice on how to maintain your posture, how to look for how to get some strategies on managing your back or your neck pain, or for that matter, your mid back pain, I have done a couple of free trainings in my free community. I will leave a link in the description of this video. The trainings are to do with neck pain, mid back pain, lower back pain, and how to achieve and maintain a good posture. So once you join the community, you have lifelong access and you can have a look at these trainings and go into more in-depth understanding and solutions for these problems. Alrighty, I'll see you guys next time. Hope this was helpful.